So welcome to our very first Let's Talk for 2021. We're happy that you're here with us. As you join, if you could put your microphone on mute, that helps us avoid background sounds. You can choose to have your video on or not. It's up to you. This is a quick half an hour survey of what's happening in substance use disorder services and needs. We have invited Angela Sullivan, who's the Executive Director of the Alcohol and Drug Council, to be with us, who will present some information for about 10 minutes. And then we do have the opportunity for you to ask questions by using the chat box. And you could type in a question and we'll take that to Angela. So we have additional, if you could mute your microphones, that's helpful to us to avoid background noise. Thank you very much. We will have additional Let's Talks planned for 2021. We have 2 more planned so far. Jan Lynch from Finger Lakes Independence Center will be with us in February, and Frank Kruppa, who's been doing amazing work as County Health Commissioner, also serves as County Mental Health Commissioner, and he'll be talking about mental health needs. If you have ideas for themes or sectors within the mission-driven world that you'd like us to speak to and or speakers, please let us know and we can create additional Let's Talks. So without further ado, Angela, I'll turn it over to you as Executive Director of our Alcohol and Drug Council. Welcome and thank you so much, all of you, for making time to be with us, and Angela, for you being with us today.
Oh, thank you, George. Thank you, everybody, for spending some of your lunchtime with me, with us. First, let me just say how grateful I am for this opportunity to speak on behalf of an issue that I'm extremely passionate about, substance use disorder, and the whole continuum of care that we have here in Tompkins County. So I am the Executive Director of Alcohol and Drug Council, but I want you to know there is a broad continuum of care in our community, and we are extremely fortunate to have providers who provide services related to prevention, harm reduction, treatment, and recovery support. And that, like all things that work well, we work together and we are able to mobilize partners on behalf of the people we serve in mental health and physical health. It is a broad group of organizations. Alcohol and Drug Council is the one I love and am most passionate about, but it is by no means the only one that has been just performing heroically over the past 10 months or so. We have been in another epidemic prior to the pandemic, and that is the epidemic of addiction and opioid related issues. And that came long before we had any knowledge of COVID-19. And so, as you can well imagine, COVID-19 has really drastically impacted our work. Just to be clear, I want to give name to some of the other providers in here in Tompkins County, just so that you have them. They're providers that we work with, partner with, refer across systems to, and those include CUGA Addiction Recovery Services, REACH Medical, STAP program, and our local mental health providers like Family and Children's and the Tompkins County Mental Health Clinic, Mental Health Association. So the behavioral health, we call it, it's not the best term for it, but it's the term we have for now. Those organizations work really closely together because mental health and substance use issues are most often connected. Our highest percentage of patients we see have both mental health concerns and substance use concerns. There was an extraordinary response, and I know we've thrown a lot of superlatives around since last February, March, but all of the providers in our region moved quickly to provide, they were very flexible and provide telehealth services for our constituents, our patients. And I would want to call out and applaud in particular Family and Children's and REACH and I believe STAP, who were actually out in the field working with our homeless populations and folks who were not able to use telehealth. I can tell you for Alcohol and Drug Council, we mobilized to 100% telehealth service delivery in 24 hours. Wow. That took amazing work on behalf of the staff and our IT company and funders. So we received funding from Care Compass Network that helped us buy some new technology that was a little further into it. but we actually, it was pretty amazing. And, Zoom, everybody knows Zoom now, but Zoom really quickly moved to give us Zoom telehealth, which was HIPAA compliant. So those things happened really, really quickly. Addiction and substance use disorder and some of the behavioral health or mental health concerns we deal with, they are certainly exacerbated by isolation and stigma. And I have to say, what has happened over the last 10 months has not helped the situation in any way. Some people have access through telehealth. There is definitely, we have a knowledge that there are people who are unable to or do not receive the same benefit from a virtual visit as would from an in-person connection with a professional or a peer. So that is absolutely some of the challenge. Is this has been tremendously isolating for most, and especially impactful for the people we serve. So we are working hard and trying to find ways to enhance connection and still do so safely. It's hard to think back to some of the other challenges we have. For me, these challenges are not new challenges to our field. They are things like stigma still exists. It's alive and well, and it impacts the people we serve every day. I, just as a little visual aid, but you probably won't see everything, I have a dear friend from high school who felt she needed to send me an article from the Buffalo News talking about how drug addicts need the vaccine also. And the fact that we had to actually write letters and say, wait, you need to think about OASIS licensed, Office of Addiction Services and Supports, New York State's licensing agency. Like, we need to be included in your plan. We need to be at the table. We have people in congregate living. We have people who have co-occurring conditions. We have people who are immunocompromised. Like, we have had to continually advocate for that. And some of the people that we hope and empowered to advocate on our behalf definitely left us to the end to think about. There were many instances where we were not even considered in the distribution of PPE, in, are we essential health workers? Like, the list goes on. And so that still exists and has made it a challenge. Our funding is compromised. We had, for the third and fourth quarters of 2020, a 20% withhold from New York State. They have yet to call it a cut, but when it comes to managing cash flow, 20% is 20%. And so that has been a big struggle. And we foresee that that will continue into 2021, even with any changes that come with federal aid. It's going to be difficult to regain some of that funding capacity. I would also say relationships matter, and how those relationships are formed between clinician and patient, or peer and peer, or organization to organization. Those are going to be challenges in the future. Prior to COVID, there have been sessions about how healthcare in general is changing in the broader United States as well as New York State. We absolutely are seeing what I would call threats from outsider corporate virtual entities making promises to our community members about the kinds of care they can receive that I would argue are not adequate, appropriate care. So yes, there is an absolute place for telehealth and teletherapy and all those sorts of things. And it does not wholly replace an individual in-person contact. And those organizations are not required to be reviewed and or licensed by New York State. Wow. And prior to all this, we had a model system for these types of services. And it is definitely being, can I use the language, attacked from without? So, and, predatory brokering and all those things in healthcare were happening already and have only accelerated.
Mhm.
And I think that the other thing that we need to really look at is strengthening our pathways for people to access care. And I will say it is a challenge, but we are really fortunate here in Tompkins County because we have a lot of initiatives. I will speak really briefly to two of them that are Alcohol and Drug Council initiatives that sort of demonstrate the broader efforts people are making. The first is we have our site on North Tripema Road, which will be the Open Access Center, Medically Supervised Withdrawal and Stabilization Center. Lots of words to basically mean in layman's term, an open access detox center, which means people can access care 24/7. Our hope is that that will be complete in the end of 2021, if not very, very early in 2022.
And Angela, this is something we've never had in this community before, and you've been planning for
Never.
years, well before the pandemic.
Yes, it
So
has been in
congratulations.
process for 5 years.
Good.
So,
Yeah.
and it is, moving through the processes,
Yeah.
which include licensing, for example, have taken time.
Sure.
So that gives people, immediate access when they're ready for information, care, referral to treatment. We're there for them. And it's what we like to call the front door to the path to recovery. And then the other is an initiative. I saw Emily Parker here on the line, our development director, who helped to launch the Healthy Workforce Network, which is a collaborative process that helps people in recovery get employment, education, and maintain employment and education to the benefit of their long-term and sustained recovery. And again, how that works is it's a partnership. Us, OAR, TC3, Challenge, the Chamber of Commerce, and Workforce New York. Emily, am I forgetting any of our partners there? I think I got them all. And so we're all working towards this. We know that supported recovery is successful recovery. So
Angela,
I think that's my 10.
That's your 10. And now we have a chance for folks to ask questions in the chat box. Staff at Community Foundation will let me know when we have a question coming up. I have a question for you. You mentioned peers a couple of times. I'm wondering what the current status of 12-step programming and meetings are. Are those available by Zoom? There's another place that used to host a lot of those down on West Seneca Street. I can't ever get the number right, 518 or whatever the number is.
Yep, that's
okay.
518.
All right, I'm going to play that number on the lottery tonight then.
Yes.
But what is happening with 12-step and peer-to-peer kind of support opportunities given the pandemic?
Sure. The 518, or what's also known as Ithaca Community Recovery, that's the organization that oversees that. They are meeting, I believe, during good weather. They were doing some limited in-person supports, and they are providing virtual AA, NA, Al-Anon, all of those meetings. So all that is going on. That is one level of peer supported work. There is also what are called credentialed recovery peer advocates. And there are by far not enough of those, but ourselves, Alcohol and Drug Council, Tompkins Cortland, Community College, and REACH are all working at building recruiting, training, and building that peer network and capacity.
So the potential volunteers for that, or they might be paid to, I don't know, but the potential folks for that would be folks who are in their recovery sufficient to be able to reach out and support others?
Correct. Or it could be someone, like a parent of a person in recovery, or so it's someone with lived experience relative to supporting another person on that path to recovery.
Right. You can put your questions in the chat box here and we'll pick those up for you. Go ahead.
It's
Nancy.
related to what you were just talking about in terms of volunteering. Someone is wondering what they can do this week, as well as something bigger to help support this kind of work. It's very important.
So we do not have volunteer opportunities right now. We're so highly regulated that most people have to go through a much more rigorous process. I think reaching out and supporting individuals and getting informed is probably the best thing. I saw Sean say that you're a peer advocate. And there's a framework of peers that ranges from, early on in recovery, or what we call drug user health issues, all the way through, the credentialed peers. And so there's a place for everyone in the system to support people through their substance use disorder issues. But I don't know, I'm looking at my other, like Emily, I don't have anything that like right now, right way. And I know it's my role. I'm loath to say funding support is essential. All of us have unfilled positions. All of us are contemplating cuts at a time when the demand for our services is increasing. We all need funding across the board.
Angela, another question. Does your group, or actually any of those groups you mentioned earlier that are part of the support group for substance use disorder, working with youth through some of the schools? And are you taking applications for your board?
Yes, we do work with youth. Our prevention and education department in particular at ADC works with youth. And through the pandemic, they actually were meeting with individuals, both distributing Narcan to the broader community, so the opioid overdose reversal medication, and meeting with students who were really struggling with the isolation and substance use issues. So they were actually doing that. We just seated at ADC our board for the 2021 year, but I would encourage whoever that was to reach out. Openings occur, and we are growing. We're more than doubling the size of our organization in 2021, and are talking about whether that requires an expansion and change in our board of directors. So please don't hesitate to reach out to me.
Angela, during the almost a year that we've been dealing with the pandemic now, 10 months or so, what have you seen or noticed in terms of requests for services? You can imagine easily an increased need, but are people coming forward? Are they accessing you? And do you see any differences by kind of constituency or population group? Are rural people more isolated, or elders accessing more? Or people can you talk about that a little bit in terms of actual access and request of services?
Yeah, so we are still pouring through the data. So this is Angela's preliminary anecdotal view.
Good.
So it could change when we go through it. What I think we have seen, especially on the clinic side, so the treatment clinic, not prevention, and some of the other outward facing, but the actual treatment clinic, outpatient treatment clinic, we found that our sort of general population who isn't sure whether or not they have an issue or they want to address an issue, that population was less likely to reach out early, right? They were less likely to say, maybe I should nip this in the bud before it becomes a bigger issue. What we really saw were more people who were like, I know I have a problem, or someone has told me I have a problem and have to be here. And they moved through the system. So like normally we interact or assess, close to between 800 and 1,000 individuals in a given year.
Wow.
That number was almost halved for this past year, but the people we saw, the higher percentage of them were both eligible or admissible to our level of care and enrolled. So there was less of this sort of like what I would like to call sort of a prevention or a harm reduction, or, sort of like before there are criminal consequences or before there are severe health consequences. We didn't have those sort of pre-contemplative people trying to get together, like trying to get services. So.
Right. In terms of, I see a question right here. I was thinking about the same question. In terms of telehealth, what about internet connectivity, which is differential, disparate from place to place? And are you finding it hard for people who want to connect with you virtually to be able to do that?
Yes, we know it's an issue. I think it's, unfortunately, we don't know all those people who are out there who don't have a way to contact us.
Mm-hmm.
So that's part of this, not seeing as many people. Like, we're doing more services and having more contact, and we're sort of more busy than ever, but with fewer pre-contemplative people. So I think that's it. I will say internet connectivity has been a huge issue for staff. So for counselors to be able to connect in a meaningful way, to be able to do video sessions instead of just telephone sessions, those sorts of things. People running out of minutes on their phone, on both sides. So those have definitely been an issue for us.
Angela, is there a difference in how you assist parents of newborns and infants at all from all these other?
I don't know that I have a good answer to that. That's something I can check into. Yeah, I am not a clinician, and so I would say I would have to get more information on that to you. I know there are, like all things that are acute, the more acute the need, the more frequent and we'll call it intensive the level of service. But I really don't know that I could answer that in a way that would clinically be appropriate.
Are people still accessing, are they able to get into residential treatment opportunities now, or is that stopped with the pandemic or slowed down?
There are, I don't know if one of my colleagues from CARS is on the call, but they are taking admissions at various residential programs now. There was a time period when they weren't early on in the pandemic, and there are, do I want to say frequent, occasional, frequent, I don't know, somewhere between occasional and frequent times when they stop admissions because they've had a limited COVID outbreak within their facility. And I will say I talk to the new CEO at CARS pretty regularly, Jessica Jansen, and they have had to drastically cut their filled bed number. Like, so if they had 45 beds, they now can only actually have 20 or 25 people.
Capacity
Those
has
are
gone
not
down.
Capacity has gone down. They have to have isolation units for people who are suspected of COVID and or are COVID positive. So that really hurts their funding situation as well.
Angela, this is.
But if somebody's looking for a bed, reach out. You can reach out to us. You can reach out to CARS. We are able to do the assessment and referral to beds. I know that regional park, CARS had beds last time I knew, and things like Tully Hill and Conifer Park. I mean, like all of these other providers in the region that are further afield than, right here in town, but they do have beds.
I have a question, Angela, with going back to telehealth, and are there apps people are using, any sort of mobile health technology?
So there are, we do not utilize any specific modality like that within our treatment planning, but there are online treatment communities. I am not as up on those at this time, but we don't use any specifically in our programming.
How about 211?
They are fully, I saw it come up, Janet. Yep. They are fully informed about what we do and what services are available when. And so they actually do make referrals. I'm always leery of talking about what we may do or what we're going to do, but we've been negotiating a contract with the regional 211 headquarters to do on-call services 24/7. So because the Open Access Center is a regional center, they're a likely partner to take calls and make referrals. The challenge with that is that it's hard to find staff. So that's the other big challenge that we're having and will continue to have in 2021 is 24-hour staffing.
With regard to,
excuse me,
the detox facility, is that what people are referring to the new Trip Hammer site about?
Yes. Yeah.
Um,
So
okay. So
it
somebody's
is,
asking about that status more
so,
specifically.
yep. Yeah, and Sean just answered about iChess. I mean, yeah, I don't know enough about them, but I know it's a feature between peers and colleagues, or peers and recipients, clients. So the status of the Detox Center is that we are working through the village planning process, so the planning department process. We do own the building, 2353 North Triphammer. And we have a design proposed to New York State that they are evaluating, and our licensing application for the 3 levels of service that we will be offering there will be, is being reviewed by New York State. So all those things are in process. Because it is a remodel process, we hope that it will move quickly. And again, that's where I can sort of say, all things remaining as they are, we should be able to open by the end of 2021.
Mm-hmm. So what it would be the easiest or most typical initial point of access if someone is concerned about someone in their family or someone themselves says, I really want to get on top of my use of substances here. It's causing me problems. What's the best 2 or 3 ways they can make a first step?
Make a phone call,
To
607-274-6288 to Alcohol and Drug Council. Because we are that licensed open access or awarded open access center, they could call. We are both mission bound and required to refer across the whole spectrum. So if what someone is looking for isn't what we offer, we are required to refer across the whole spectrum. So that's a clear way to do that. The other is you can send us an email through our website, so alcoholdrugcouncil.org. That is on our list for 2021. We did find that when everything went sideways because of COVID, we did not have a robust enough, flexible enough website to respond. And so it is not the best representation of who we are, but it works at this point. And then once we return, hopefully around March, to more in-person services, you can actually walk in. We're not quite there yet. State still recommends telehealth as the preferred modality. But once we get there, the other way would be to literally walk in the doors. And when open access is running, that could be at 2 a.m.
So for help, you said the number was 607-277.
274-6288. That's our main phone number.
There you go. And as we begin to wrap up here, these Let's Talks are always meant to be just sort of a initial taste. Things are going to change over time. I would say stay in touch with all the good folks at Alcohol and Drug Council and CARS and REACH and Southern Tier AIDS Program. It is a nice partnership and combination of folks who are working together. With the detox facility, is there anything now that's now missing in the overall continuum of care? I know that was a big part of it, but do you have all the pieces that you want to, or what are you looking forward to doing next? Maybe is another way to ask that question.
So I'm looking forward to finishing our current project before I can think of anything else. And I owe Sean a big apology. I see him representing Unity House. They are our newest partner that sort of joined the table. So I apologize, Sean. Unity House has part of what's really needed in our continuum for recovery, sustained recovery, and that's housing. And so I would say that is, as a community, that's the consistent but next big thing, is that, we need supportive, recovery focused, all of those sorts of things, because if you can't meet people's basic needs, like housing, recovery is impossible.
Absolutely. Well, I want to thank Angela Sullivan, Executive Director of the Alcohol and Drug Council, for doing our first Let's Talk of 2021 to talk about substance use disorder needs and services. I'm very excited, very proud of our community for pulling so many actors together and so many partners in the work that we're doing. I want to thank each one of you for making time to be with us during this half an hour. Our next Let's Talk here at the Community Foundation is coming up on February 9th from noon till 12:30. And that will have Jan Lynch from the Finger Lakes Independence Center talk about issues for people with disabilities. And this recording of this will be available soon on our website. Thank you very much and have a good rest of your day.
Thank you, everybody.